Welcome. Today, we're taking something that can feel, well, a little intimidating, the 12-lead ECG, and we're going to turn it into a simple, memorable mission. The goal? To help you master it so you can get a perfect reading every single time. All right, so let's jump right in. And you know what? Forget about those super complicated medical diagrams for a moment. I want you to think of this more like a quest for precision. We're going to follow a map, find some hidden landmarks, and unlock the electrical story of the heart, step by step.
First things first, just like any successful mission, it all starts with the right prep work. I mean, you wouldn't climb a mountain without the right gear, right? Same idea here. You just can't get a clear ECG without setting the stage perfectly.
So here's your mission toolkit. You're going to need 10 electrodes, some alcohol pads to clean the skin, a little bit of abrasive tape for a solid connection, and maybe some trimmers, if the patient has a lot of chest hair that might get in the way. Now, let's get our patient ready. There are 4 steps here that are absolutely non-negotiable, and they're just as important for the patient's comfort as they are for us getting a clean, readable signal. So ideally, you want your patient lying flat on their back, what we call the supine position. But hey, some patients just can't tolerate that, and that's okay. A semi-Fowler's position is a perfectly fine alternative. The most important thing here is just being consistent.
And please, always remember, you're working in a private area. Preserve the patient's dignity. You only need to expose what's necessary, so use a towel or a drape to cover them up. It's a small act of respect that makes a really big difference.
Okay, listen up, because this right here, this is the secret sauce for a good connection. It's all about proper skin prep. You're going to take an alcohol pad to get rid of any oils or lotions, but, and this is key, let it dry completely. Then, a little light abrasion with some tape gets rid of dead skin cells. Do that, and that electrode will stick like glue, and you'll get a crystal clear signal. All right, let's move on to our first real placement task. We're starting with the forelimb leads. These are pretty straightforward, and they give us our first set of electrical viewpoints of the heart. It's 1 electrode on each limb. For the arms, it goes in the forearm, just a little above the wrist. And for the legs, it's on the lower leg, just above the ankle. The key word here is symmetry. You really want to aim for the exact same spot on both the left and right sides. Now, how do you remember the colors so you never have to guess? Easy. We have a simple mnemonic. On the patient's right side, just think clouds over trees. That's white on the arm and green on the leg. And on the left side, it's coal over fire. Black on the arm, red on the leg. Simple, right?
All right, now for the main event, the chest leads. Don't be intimidated. Seriously, this is just an anatomical treasure hunt, and I'm about to give you the map and show you exactly where X marks the spot. Okay, here we go. First, find the sternal notch. It's that little dip right at the top of the breastbone. Now, slide your fingers down just a bit until you feel a distinct bony ridge. Found it? That's it. That's the angle of Lewis. It sits right next to the second rib. From there, just feel your way down 2 spaces between the ribs, and boom, you've found your target, the 4th intercostal space. And this really shows why finding that little bony hump is so critical. The angle of Lewis is your anchor point, your North Star for this whole procedure. Once you find it, you can navigate the rest of the chest with total confidence. Now that we've found our landmarks, the treasure hunt is almost over. We can now confidently and precisely place the 6 chest electrodes, which are also known as the precordial leads. So your first 2 chest leads, V1 and V2, they're like partners. They sit directly across from each other in that 4th intercostal space you just found. V1 goes just to the right of the sternum, and V2 goes just to the left. It's as simple as that. Okay, now here is a huge pro tip. This is going to save you from a really common mistake. You do not place these leads in numerical order. You place V1 and V2, then you skip V3 completely and go straight to V4. Then you go back and fill in V3. Trust me, following this exact sequence is the absolute key to getting perfect spacing every single time. So here's how we use V4 and V6 as our next set of anchors. V4 lands in the 5th intercostal space right on the mid-clavicular line. Think directly below the middle of the collarbone. V6 is at that same horizontal level, but way over on the mid-axillary line, which is basically the middle of the armpit. Once those 2 are locked in, you just fill in the gaps. V3 goes midway between V2 and V4, and V5 goes midway between V4 and V6. And you've done it. The electrodes are placed perfectly. The treasure map has been followed. Now for the final, really satisfying step, connecting the right colored wires to the right electrodes.
And just like with the limb leads, we've got a final code to crack for the chest lead colors. This simple phrase you see here is the key to completing our mission perfectly.
You've got to commit this phrase to memory. Rainbows yield great beauty, offer green peace. Red, yellow, green, blue, orange, purple. That's the key. It unlocks the final part of the puzzle and makes sure you connect every single lead correctly, from V1 all the way to V6.
And there you have it. You've officially completed this guide to perfect 12-lead ECG placement. You've got the map, you've got the landmarks, and you've got the codes. So the question is, what complex skills should we break down and master together next?